Cancer is a disease characterized by the uncontrolled growth and spread of abnormal cells in the body. Normally, cells in the body grow, divide and die in an orderly manner, but cancer cells do not die off like normal cells and instead continue to grow and divide, forming a mass of tissue known as a tumor. Cancer can occur in any part of the body and can spread to other areas through the bloodstream or lymphatic system, a network of vessels and tissues that help to fight infection. There are many different types of cancer, each with their own specific symptoms and treatment options. Some common types of cancer include breast cancer, lung cancer, prostate cancer, colorectal cancer, skin cancer, leukemia, lymphoma, pancreatic cancer, ovarian cancer, bladder cancer. Breast cancer is a type of cancer that starts in the cells of the breast tissue. It occurs when abnormal cells in the breast begin to grow out of control, forming a mass of tissue called a tumor. Breast cancer can be invasive, meaning it has spread to nearby tissues, or non-invasive, meaning it has not spread beyond the milk ducts or lobules of the breast. Breast cancer is the most common cancer in women worldwide and can also occur in men, although it is rare. Some common symptoms of breast cancer include a lump or thickening in the breast, changes in the size or shape of the breast, dimpling or puckering of the skin, nipple discharge, and changes in the appearance of the nipple. Risk factors for breast cancer include age, gender, family history, certain gene mutations, exposure to estrogen, obesity, and alcohol consumption. Early detection is key to successful treatment, and regular mammograms and breast exams can help detect breast cancer in its early stages when it is most treatable. Treatment for breast cancer can include surgery, radiation therapy, chemotherapy, and hormone therapy, among other options. Lung cancer is a type of cancer that starts in the cells of the lungs. It occurs when abnormal cells in the lungs begin to grow out of control, forming a tumor. Lung cancer is typically divided into two main types: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC. NSCLC is the most common type of lung cancer, accounting for about 85% of all cases. Lung cancer often does not cause any symptoms in its early stages, and many people do not experience symptoms until the cancer has progressed. Some common symptoms of lung cancer include a persistent cough, chest pain, shortness of breath, hoarseness, coughing up blood, unexplained weight loss, and fatigue. Risk factors for lung cancer include smoking or exposure to secondhand smoke, exposure to certain chemicals and substances such as asbestos and radon, family history of lung cancer, and certain genetic mutations. Lung cancer is often diagnosed through imaging tests such as X-rays, CT scans, and PET scans, as well as biopsies of the lung tissue. Treatment for lung cancer depends on the type and stage of the cancer and may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. As with other types of cancer, early detection is key to successful treatment and improved outcomes. Prostate cancer is a type of cancer that occurs in the prostate gland, which is a small gland in men that produces seminal fluid. Prostate cancer occurs when abnormal cells in the prostate gland begin to grow out of control, forming a tumor. Prostate cancer is one of the most common types of cancer in men, and typically occurs in older men. Prostate cancer often does not cause any symptoms in its early stages, and many cases are detected through routine screening tests such as the prostate-specific antigen, PSA, blood test or a digital rectal exam, DRE. Some common symptoms of prostate cancer may include difficulty urinating, decreased urine flow, blood in the urine or semen, and pain in the lower back, hips, or thighs. Risk factors for prostate cancer include age, family history of prostate cancer, and certain genetic mutations. Diet and lifestyle factors, such as a diet high in red meat and dairy, and obesity, may also increase the risk of prostate cancer. Treatment for prostate cancer depends on the stage and grade of the cancer, as well as the individual's overall health and preferences. Treatment options may include watchful waiting or active surveillance, surgery, radiation therapy, hormone therapy, and chemotherapy. As with other types of cancer, early detection is key to successful treatment and improved outcomes. Colorectal cancer, also known as colon cancer or rectal cancer, is a type of cancer that occurs in the colon or rectum. It occurs when abnormal cells in the colon or rectum begin to grow out of control, forming a tumor. Colorectal cancer is one of the most common types of cancer in both men and women. Colorectal cancer often does not cause any symptoms in its early stages, and many cases are detected through routine screening tests such as colonoscopies or stool tests. Some common symptoms of colorectal cancer may include changes in bowel habits, such as diarrhea or constipation, rectal bleeding, abdominal pain or cramping, and unexplained weight loss. Risk factors for colorectal cancer include age, family history of colorectal cancer, certain genetic mutations, inflammatory bowel disease, a diet high in red and processed meats, obesity, and a sedentary lifestyle. Treatment for colorectal cancer depends on the stage and grade of the cancer, as well as the individual's overall health and preferences. Treatment options may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. As with other types of cancer, early detection is key to successful treatment and improved outcomes. Skin cancer is a type of cancer that occurs in the cells of the skin. It is the most common type of cancer in the United States, and it occurs when abnormal cells in the skin begin to grow out of control, forming a mass of tissue called a tumor. There are several types of skin cancer, including basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma and squamous cell carcinoma are the most common types of skin cancer and are typically caused by exposure to ultraviolet (UV) radiation from the sun or tanning beds. These types of skin cancer often occur in areas of the body that are frequently exposed to the sun, such as the face, neck, arms, and hands. Melanoma is a less common but more dangerous type of skin cancer that can occur anywhere on the body, even in areas that are not exposed to the sun. Melanoma is often caused by intense, intermittent exposure to UV radiation, such as from sunburns. Symptoms of skin cancer may include changes in the size, shape, or color of a mole or other skin lesion, the appearance of a new mole or lesion, and a sore that does not heal. Treatment for skin cancer depends on the type and stage of the cancer and may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Prevention measures such as protecting the skin from the sun, avoiding tanning beds, and performing regular skin self-exams can help reduce the risk of skin cancer. Leukemia is a type of cancer that affects the blood and bone marrow, which are the tissues responsible for producing blood cells in the body. It occurs when abnormal blood cells, usually white blood cells, begin to grow out of control and interfere with the normal production of blood cells. There are four main types of leukemia, including acute lymphocytic leukemia, ALL, chronic lymphocytic leukemia, CLL, acute myeloid leukemia, AML, and chronic myeloid leukemia, CML. These types are classified based on the type of blood cell affected and how quickly the disease progresses. Symptoms of leukemia may include fatigue, weakness, fever, frequent infections, easy bleeding or bruising, swollen lymph nodes, and pain in the bones or joints. The exact causes of leukemia are not fully understood, but risk factors for the disease include exposure to high levels of radiation or certain chemicals, previous chemotherapy or radiation therapy, certain genetic disorders, and a family history of leukemia. Treatment for leukemia depends on the type and stage of the disease, as well as the individual's overall health and preferences. Treatment options may include chemotherapy, radiation therapy, targeted therapy, immunotherapy, and stem cell transplant. With proper treatment, many people with leukemia are able to achieve remission or a cure. Lymphoma is a type of cancer that originates in the lymphatic system, which is a network of tissues and organs that helps to protect the body from infections and diseases. Lymphoma occurs when the cells in the lymphatic system, primarily white blood cells called lymphocytes, begin to grow and divide uncontrollably, forming a tumor. There are two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is a less common type of lymphoma that is characterized by the presence of Reed-Sternberg cells, which are large, abnormal cells found in the lymphatic tissue. Non-Hodgkin lymphoma is a more common type of lymphoma that can arise from any type of lymphocyte. Symptoms of lymphoma may include swelling of lymph nodes, fever, night sweats, weight loss, fatigue, and unexplained itching. Risk factors for lymphoma include a weakened immune system, exposure to certain chemicals or radiation, certain viral infections such as Epstein-Barr virus or HIV, and a family history of lymphoma. Treatment for lymphoma depends on the type and stage of the disease, as well as the individual's overall health and preferences. Treatment options may include chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell transplant, or a combination of these approaches. With proper treatment, Many people with lymphoma are able to achieve remission or a cure. Pancreatic cancer is a type of cancer that originates in the pancreas, a gland located behind the stomach that produces digestive enzymes and hormones that regulate blood sugar. Pancreatic cancer occurs when cells in the pancreas begin to grow and divide uncontrollably, forming a tumor. Pancreatic cancer is one of the deadliest forms of cancer, with a very low survival rate. This is because it often does not cause symptoms until it has spread to other parts of the body, making it difficult to diagnose and treat. Symptoms of pancreatic cancer may include abdominal pain or discomfort, jaundice, yellowing of the skin and eyes, unexplained weight loss, loss of appetite, nausea, and fatigue. Risk factors for pancreatic cancer include smoking, obesity, a family history of the disease, chronic pancreatitis, and certain genetic mutations. Treatment for pancreatic cancer depends on the stage and location of the cancer, as well as the individual's overall health and preferences. Treatment options may include surgery, radiation therapy, chemotherapy, targeted therapy, or a combination of these approaches. In many cases, pancreatic cancer is not curable, but treatment can help to manage symptoms and extend the individual's life. Ovarian cancer is a type of cancer that affects the ovaries, which are the female reproductive organs that produce eggs and hormones. Ovarian cancer occurs when cells in the ovaries begin to grow and divide uncontrollably, forming a tumor. Ovarian cancer is often difficult to detect in its early stages, as it may not cause symptoms until it has spread to other parts of the body. Symptoms of ovarian cancer may include abdominal bloating, pain or discomfort in the pelvis or abdomen, feeling full quickly while eating, changes in bowel habits, and unexplained weight loss. There are several types of ovarian cancer, including epithelial ovarian cancer, which is the most common type, germ cell tumors, and stromal tumors. Epithelial ovarian cancer is further classified into different subtypes based on the type of cell that is affected. Risk factors for ovarian cancer include a family history of the disease, certain genetic mutations, such as BRCA1 and BRCA2, age, most cases occur in women over 50, and a personal history of breast or colorectal cancer. Treatment for ovarian cancer depends on the stage and location of the cancer, as well as the individual's overall health and preferences. Treatment options may include surgery, chemotherapy, targeted therapy, and radiation therapy. With proper treatment, many women with ovarian cancer are able to achieve remission or a cure. Bladder cancer is a type of cancer that originates in the bladder, which is a muscular organ in the lower abdomen that stores urine. Bladder cancer occurs when cells in the lining of the bladder begin to grow and divide uncontrollably, forming a tumor. Symptoms of bladder cancer may include blood in the urine, pain or discomfort during urination, frequent urination, and urinary urgency. There are several types of bladder cancer, including transitional cell carcinoma, which is the most common type, squamous cell carcinoma, and adenocarcinoma. Transitional cell carcinoma develops in the cells that line the bladder, while squamous cell carcinoma and adenocarcinoma are less common and typically occur in the lining of the bladder after long-term irritation. Risk factors for bladder cancer include smoking, exposure to certain chemicals, such as those used in the dye and rubber industries, chronic bladder infections or irritations, and a family history of bladder cancer. Treatment for bladder cancer depends on the stage and location of the cancer, as well as the individual's overall health and preferences. Treatment options may include surgery, radiation therapy, chemotherapy, immunotherapy, and targeted therapy. With proper treatment, many people with bladder cancer are able to achieve remission or a cure. The symptoms of cancer can vary depending on the type of cancer and its stage. Some common symptoms of cancer include fatigue or weakness, unexplained weight loss, pain, especially if it's persistent or worsening, skin changes, such as yellowing or darkening of the skin, or changes to moles or warts, changes in bowel or bladder habits, such as diarrhea, constipation, or frequent urination, persistent cough or hoarseness, difficulty swallowing or persistent indigestion, swelling or lumps in the body, such as in the breast, lymph nodes, or testicles, bleeding or bruising without an obvious cause, one-night sweats or fever. Cancer is caused by a variety of factors that can damage the DNA in cells, leading to uncontrolled growth and division. Some common causes of cancer include 1. Genetic mutations, changes or errors in genes that regulate cell growth and division can lead to cancer. These mutations can be inherited or acquired over time. 2. Exposure to carcinogens. Carcinogens are substances that can cause cancer. Examples include tobacco smoke, radiation, chemicals in certain products, and environmental pollutants. 3. Viruses. Some viruses, such as HPV and hepatitis B and C, can increase the risk of certain types of cancer. 4. Lifestyle factors. Unhealthy lifestyle choices such as a poor diet, lack of exercise, and excessive alcohol consumption can increase the risk of developing cancer. 5. Chronic inflammation. Long-term inflammation in the body, such as from infections or autoimmune diseases, can increase the risk of cancer. 6. Age. The risk of developing cancer increases with age, as cells are more likely to accumulate DNA damage over time. The treatment of cancer depends on several factors, including the type and stage of cancer, the individual's overall health, and their preferences. The main treatments for cancer include surgery. Surgery involves removing the cancerous tumor and surrounding tissue. It is often the first treatment option for solid tumors that have not spread to other parts of the body. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells. It may be used alone or in combination with surgery or chemotherapy. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. It may be given orally or through and may be used alone or in combination with other treatments. Immunotherapy. Immunotherapy uses the body's immune system to fight cancer. It works by stimulating the immune system to attack cancer cells or by blocking the proteins that allow cancer cells to evade the immune system. Targeted therapy. Targeted therapy uses drugs that target specific molecules involved in the growth and spread of cancer cells. Hormone therapy. Hormone therapy is used to treat certain types of cancer that are hormone dependent. It works by blocking the hormones that stimulate the growth of cancer cells. Stem cell transplant. A stem cell transplant involves replacing diseased bone marrow with healthy stem cells. It may be used in the treatment of certain types of blood cancers.